I actually have a number of thoughts on this specifically, and I just like to preface it by saying that chief nursing officers respect and you know truly understand the importance of their nurse managers. Sometimes in some organizations there's an additional layer in between the chief nurse. In some cases, a nursing director who has a number of units. As we look at across the healthcare landscape, we see a lot of different structures, but those managers are really the frontline leaders. And our CNOs are working on promoting a healthy work environment in terms of physical safety, but it goes beyond physical, really creating a culture of psychological safety, flexible scheduling, and just, an opportunity for the staff nurses to feel like they're not just cogs in a wheel, but they actually have skin in the game, and they have some say over, the work that they do and the environment that they practice in. The managers need to feel safe, and it's up to the chief nursing officers and chief nurse executives to create that environment so that managers can feel safe to take some interpersonal risks, for example, to speak up, to quite frankly disagree perhaps with some of the directives that they receive, and to surface concerns without fear of negative repercussions. They understand what it's like on the front line, and they have to feel free to be able to communicate that back to executive nursing leadership. And also, they have to feel like they can tell it like it is and not sugarcoat perhaps some of the messaging that they really do need to communicate to their leadership team. So, that's an important role or an important environment for the chief nursing officers to create specifically for the managers and directors in this case. The nurse executives and the CNOs need to have resources and really advocate with with finance, for example, for resources to provide formal training and development for their nurses who are either aspiring to managerial roles and to leadership roles, or for those nurses that are in those roles. I mean, it takes continuing leadership development and education, because we know there's always something new to learn, and things are changing in healthcare very rapidly. Nurse managers told us how important it is to actually see their leadership and to have communication conversations with them, not just quick flyby rounds where leaders will stroll through a unit, say hi, try to check in with the staff quickly, but really schedule time for managers to be able to engage in dialogue. So those are some tips. I probably have a few more, but I think those are the the top of my list that I would advocate for CNOs to make sure that they pay attention to.